At Flair, we're a healthcare venture capital firm dedicated to investing in healthcare technology companies that are innovating in exciting ways. And we're really excited to have you join us today. This is our 15th quarterly expert roundtable, and we'll be discussing pharmacy technology innovation. All right, so I will briefly set the stage with some data before we dive in with our panelists. And since the topic of today's conversation is pharmacy technology innovation, here are some quick grounding stats on prescription drug spend in the US. It's likely, as you can see, that we'll spend between $700 billion and $800 billion on prescription drugs this year. And it's hard to argue that the US leads the world in pharmaceutical innovation. We also are at the front of the pack in spend per capita. When we compare to the average of OECD nations, the average basket spent about $600 per capita in 2021 on prescription drugs. The US spent more than twice that number, with over $1,400 spent on drugs per American. So it's not entirely surprising that a large number of adults in the US say that they can't take their meds as prescribed due to cost concerns. And we know that suboptimal adherence can drive more overall spend in our system. It was estimated in 2016 that non-optimized medications cost the US healthcare system about $500 billion in medical spend. And some of these stats were studied and published by companies that we'll hear from today. So excited to dive more into some of the nuance of these challenges and how companies are using technology to solve them. Now, we also see interesting trends on utilization by pharmacy type, or where Americans get their scripts filled today. Of course, retail chains that we're all very familiar with really fill a lot of the high majority of the total prescriptions in the US. Between 2010 and 2020, we saw a lot of consolidation and acquisition activity in this cohort. Now we're entering more of a phase of rationalization. We're seeing frequent headlines around store closures that are planned. As we think about smaller pharmacies or independent pharmacies, the number of independent pharmacies actually has decreased by about 50% since 1980, a staggering number. And on the mail order and online pharmacy front, many of these pharmacies have been around for a long time. I think this audience will be very familiar with some of the pharmacies that have emerged, direct-to-consumer online pharmacies in the last 10 to 15 years. Those have garnered over $3 billion in venture capital funding and have also garnered a nice slice of total prescription volume in the US. Regardless of pharmacy type, it seems that none have really been immune to some of the financial and staffing pressures that have plagued the industry over the last couple of years. We see a large number of independent pharmacies reporting they're at risk of going out of business as soon as this year. We also see large pharmacy chains reporting that they're likely to close between 1,000 and 2,000 stores as soon as next year. And we also see really unprecedented pharmacist staffing challenges. We see less graduates year over year from four-year pharmacy programs. And we also see that applications to pharmacy schools have fallen a very significant 64% in the decade between 2012 and 2022. We've also seen a slew of legislative and legal actions on the pharmacy landscape, and we'll leave it to some of our speakers today to point to whether any of these events have really generated headwinds or tailwinds as they've built and operated their companies. But despite, or likely in light of, some of the challenges that we've highlighted today, we've also seen really exciting technology-driven investments, both in robotics as well as software. Our content today will likely focus more on the latter there, as we're seeing really exciting AI-driven platforms support pharmacists in a lot of their day-to-day activities and really improve provider and patient experiences with pharmacies in ways that were never possible in the past. So we're excited to dive in with our speakers today and learn what they're up to and how they're driving innovation on the landscape, as well as where they still see exciting areas for opportunity. So excited to introduce our speakers and orient you to the format of the next 60 minutes or so. We're excited to first have a fireside chat with Trevor Bezdek, co-founder and chairman of GoodRx. We'll then move into a panel with a couple innovators who are leading emerging companies in the pharmacy technology space. Una Kim, co-founder and CEO of Arene, and Otto Seip, co-founder and CEO of Photon Health. And last but not least, we're very excited to hear from Dr. John Wigg, Chief Medical Officer at Walmart. So I will now pass it over to my colleague, Dan Gebremedin, for a conversation with Trevor.
Thanks, Tara. We'll invite Trevor to the stage. Trevor, so great to see you. As Tara flagged, you are the co-founder and chairman of GoodRx, but also the former co-CEO. And GoodRx is a company that probably doesn't need much of an introduction. And I'm not sure if you guys created the discount card, but certainly popularized it and really dramatically changed the way that consumers interact with their prescriptions, how they obtain their prescriptions. Just some stats that I pulled. Last year, you enabled 100 million prescriptions for consumers and have generated over $75 billion in savings. And so really excited to dive into that history and that story. But maybe let's start off with your background first, Trevor. Talk to us a little bit about your career journey in ARC and how it led to the founding of GoodRx.
Sure. I studied biology and computer science and was on the path to be a researcher, medical doctor and researcher. But at some point, I started a company making computational biology software with someone in the laboratory I worked with, and then just kept deferring my MD PhD admission and never ended up going, much to the slight unhappiness of my parents. But eventually they seem content enough these days. We started GoodRx, actually, me and Doug Hirsch and another individual named Scott Marlette. We had decided we were going to work together, look at different problems. I actually met Doug because our mothers are friends, and Doug had just come off his stint as one of the first employees at Yahoo and being the head of product at Facebook. And I had just sold a second company, and yet our mother still forced us to go meet each other because that's how they are. And we went and met and started looking at different problems. We started GoodRx specifically because Doug got a prescription, and Doug is one of the cheaper people that I've ever met. And so he went to I think it was the CVS here. I'm in Santa Monica right now, which is where our office is. And he went to the CVS here in Santa Monica, and it was about $400 for the prescription. He thought that was too much. And so he went to another pharmacy. It was about $350. He tried calling a pharmacy, and they wouldn't give him a price for it unless he came in to fill the prescription. And it just led us on this sort of interesting journey to explore prescriptions. When we started this was, we are tech people. Like I can do some like DNA cloning or something, but like healthcare policy is certainly outside any area of expertise we had when we started this business. We approached this just as a really interesting area where we were looking at prescriptions at the time, and in about 2011, and when you searched on Google for something as simple as like Lipitor price, there was no results. There was no good results to that simple question. And this is an area where consumers spend a great deal of money. The system as a whole spends obviously a huge amount of money, as your sort of initial stats spoke to. But then if you look at just out-of-pocket spending, it's a meaningful category of spend. If I were to look at how much me as an average male spends on apparel in America, I certainly Americans spend far more out of pocket on prescription drugs than they do on apparel. And yet there was a billion websites to help you navigate buying some clothes, and there was nothing in the space of prescriptions. And so we just thought it was an interesting problem to dig in and try to figure out what do medications cost and help provide that information to consumers. And that's where we started.
Yeah, it's two entrepreneurs who didn't necessarily come from enterprise healthcare, appreciated a personal problem, and just saw a lot of inefficiency in the system that was quite meaningful and important for you. I'm curious, the origin story of GoodRx, how did that lead to the ultimate business model that you ultimately pursued? What did that journey and that iteration look like?
Yeah, there were a lot of iterations. We did not know the answer, nor do we know the answer now, that we continue to iterate here and continue to evolve what the solutions are. Where we started was price discovery. We were just wanted to address what I guess easy to use price transparency. When we first tried to figure out what the pricing was, we were looking through websites from PBMs at the time, and I recall on the PBM that our insurance company at the time used, which was one of the big three PBMs, it took over 20 clicks to get the price of one prescription at one pharmacy. It then was like 15 more clicks to then look up the price of that prescription at a different pharmacy, and the prices were all incorrect. So it was a mess, I would say. And so where we started was looking at easy to use price transparency. And what that evolved into a bit was how can that then transition into affordability? So for generic prescriptions in particular, originally, how do we then provide tools to consumers so that they can understand the price and then afford them and get them for themselves and their children, their families? And so we iterated on it just as we discovered different approaches we could take to enable that affordability. And hopefully I'll talk a little bit more later about some of the new things we're doing to try to expand affordability beyond what we've done with generics, and now also provide new affordability solutions in the brand drug market and across any type of prescription that a consumer may have.
A lot of great insights. Clearly, the realization there was no price transparency whatsoever as consumers obtained kind of prescription drugs. And I think many people, right, have documented how convoluted our prescription drug industry is, with PBMs playing a really important role. What gave you the confidence, or what was maybe easier than you thought and harder than you thought, trying to navigate this market space with such dominant players? And ultimately, what was the realization, or what did you appreciate that gave you a business model that was able to succeed in a marketplace where a lot of innovation has been stifled?
Yeah, I think we probably partially just didn't know enough to be scared of all the things that were out there. I do think entrepreneurship requires a little bit of a leap of faith across a lot of areas. And I think it can sometimes be a little difficult when you're too far in it to see both what's possible and to see that there are different ways to do things. I think in healthcare, one observation I've had is it is important to be in some manner in the flow of funds of healthcare transactions. And so I recall going to Health 2.0 with Doug, my co-founder, not 8, 9 years ago, and seeing a lot of companies with pretty interesting technologies. And yet they weren't in that flow of funds. They were just like a nice technology solution for a consumer. And I think largely those have really struggled to get adoption. When I think of what makes both good consumer solutions, but also a good business, I do think you have to get into the flow of funds of these healthcare transactions. So I think we were very fortunate because the transactions we're enabling largely are able to go around the traditional system. They're able to then help the pharmacies capture transactions that were otherwise where people were just going to walk away and not fill those transactions. We've done more and more to help pharmacies and be really good retail partners with retail to help them manage the margin of those transactions. We are able to do the same for brand manufacturers, helping them get prescriptions filled that otherwise wouldn't be filled, helping consumers get prescriptions that otherwise they just can't afford for their children, for themselves. And I think of other spaces like if you run a Medicare Advantage plan, you're in the flow of funds of those transactions, and you can really capture the value of things you create. And I worry in some cases about some of the digital health companies that don't have that opportunity, just that can be a bit challenging.
It's a super powerful insight. If I'm understanding you correctly, you may be able to build a great product that has great design and great usability and may get engagement. But if you're not in the middle of the healthcare transaction and the existing payment behavior, so to speak, or the buying behavior of large enterprises it's going to be really hard to capture the value that you're creating. And maybe expand a little bit on that with respect to GoodRx's business. You've expanded into other areas. My sense is there are relationships with life sciences companies. You've built telemedicine businesses. There's a membership business. Maybe talk a little bit about the additional unlocks you've been able to achieve with the GoodRx platform.
Yeah, so I think the most important one that I'd like to highlight is what we're doing with pharma manufacturers. I, we've, I believe, made a huge impact on affordability for generic prescriptions. As you mentioned in your very nice intro, we're approaching $80 billion saved for consumers. So this is across a lot of transactions. And these are cases where, even if you look at iPhone app reviews, I remember happily looking at iPhone app reviews in early days, and the reviews weren't like, oh, I saved 20 bucks. The reviews were, I took my medication every other day. Now I can take it every day. I couldn't afford this medication for my child, and now I can. These are medications that the price point where someone walks away and doesn't fill a prescription in America is not very high. And so by enabling these savings, we're letting people fill prescriptions that just otherwise weren't being filled, and where these are normal prescriptions. These are like your antifungal cream. This is your statin. These are core medications that are providing important value for you and keeping you from going back to your healthcare provider or having some more expensive later events. We are happy to do that. But brand medications, that ecosystem is more challenging. And so we've really doubled down on working with brands on helping them deliver effective solutions for access for these more expensive medications. Generally speaking, these are not the $30,000 medications, but these are all the medications that are in the couple $100 to low $1,000 type price range. And in this case, we have a lot of these programs now available on GoodRx. And we want every brand patient assistance affordability program being featured on GoodRx. We can make these work better for patients, for brand, for retail. This is a win for everyone. We can make on the retail side, make these better transactions for them. Higher margin transactions get filled that otherwise are getting walked away from. So that's an area we're really focused on and trying to continue what we're doing there and really make it so that no matter what medication you're trying to get, you can come to GoodRx, and we're going to really help you navigate that and provide both the price transparency, but the affordability solutions.
I mean, super powerful. And I appreciate you sharing the connection to mission and that you're not just improving lives. And in some cases, you're probably saving lives, right? By giving people access to these important medications that they otherwise wouldn't take. So that's great to hear. It may be related to that. With many early stage companies that go into healthcare, there's this dichotomy that we oftentimes put them in either direct to consumer or B2B2C. GoodRx has built such a powerful consumer brand. How do you think about the company? Is it a D2C company? Is it a B2B2C company? How do you think about it?
Yeah, I think that's a hard question for me to answer, because I think what we've done, the people using GoodRx day to day are consumers or healthcare providers. And so that is our day-to-day user that we're building product for. However, the B2B partners that we work with to provide the marketplace are incredibly important partners for us. And we want to spend substantial amounts of our efforts making that process better for them, making product improvements to make the process at the pharmacy counter for the pharmacy staff seamless. Dr. John Wigg, Chief Medical Officer at Walmart, speaking later. Walmart's been an amazing partner to us, and we're so excited to work with partners like Walmart to figure out just how to make this flow better for their staff, for our staff. So I think of it, to your question, as that we are trying to meet the needs of consumers. We are trying to meet the needs of healthcare professionals. And I think as an ethos of a company, that's our ethos. Our ethos is let's help the consumer. Let's just do what's best for the consumer. And that drives user experience discussions. That drives product discussions. If you look at how product teams, for example, are organized, one of the largest teams here is how are we just making this better for our partners? How do we make it better for the pharmacies? How do we make that point of the interaction there? I think of it a little bit as it's a B2C. We're running a marketplace, and so we have to fulfill the needs of all the parties. Sorry
All
for
right,
not
Trevor,
answering.
this is my last question. It'll be a two-part question because
Okay.
I wish we had more time. But talk a little bit about the regulatory landscape in pharmacy and innovation, and maybe weave that into advice for entrepreneurs who are trying to build in the pharmacy innovation space.
That was a one-part question, but I'll answer it. I think the regulatory environment is tricky, but maybe for different reasons than are obvious. There's obviously a huge amount of change happening around regulation of PBMs, of pharma manufacturers, of these type of entities. And I see that's just an evolving landscape. That's what's always been occurring. I think we as GoodRx are aligned with what the regulators want in that regard. We want healthcare to be affordable and people to get their prescriptions and there to be more price transparency. And so for our business, I don't actually see that as having much of an impact here as we go forward. I do think these are important regulations, and it's important to figure out how America as a whole can spend less of GDP on healthcare and get better outcomes. And these are worthwhile areas of regulation. And I think we have built a uniquely ornate system in America that does make it quite hard to solve some of these things between 340B and just the system we've built. But I look for that. The one highlight I'd say is just, I think I was always of the perspective on things of, I want to know the rules and have our attorneys tell us the rules, and I want to follow every rule. We are boring people. We want to know, what are we supposed to do, and let's do that. But I would say for digital health startups, it's just a pretty complex environment now, particularly around topics such as what is the future state of medical privacy in certain regards, where there's just a lot of parts of, I think, healthcare now where there aren't clear rules. And you have a wide set of state rules, you have a wide set of federal rules, and you have a lot of cases where just there aren't rules and it's going to be interpreted after the fact. And I just would say, I feel like even more so than any time before, people in this space just have to be really conscientious, really think a step ahead and go beyond what's maybe required in any case, and just be looking out for what's out there in the future, how you can be truly a best actor and respect patients and do well.
Perfect. Thank you for such insightful advice, Trevor. Really appreciated your time. I'll now transition to my colleague, Tara, for her conversation with Unichem and AutoSite. Tara?
Perfect. Thank you, Dan.
Thanks, Dan. Thanks, Trevor. Great insights that will surely flow right into this next segment here. So we have two fantastic entrepreneurs who have joined us on stage. We have Otto and Una here today. Thanks, both of you, for being here. I'm going to turn it straight over to you so we can keep moving. Please, I'll ask you to take a minute to introduce yourself, share a little bit about your background, and also introduce us to the company that you're building. And Una, I'll ask you to go first.
Hi, everyone. My name is Una Kim. Thank you so much for having me and addressing the important topic in the world of pharmacy and how much we do need to focus on innovating in this space. I'm the co-founder and CEO of Arene. Arene is a medication intelligence company with a mission to ensure safe and effective medication therapy. By background, I'm a pharmacist and health economist. So before starting Arene, I've spent many years in the healthcare industry, essentially evaluating different healthcare interventions. And that's when I realized that really getting the medications right is such a powerful lever to improve quality of care and reduce unnecessary waste in our system. So that's what was the passion behind starting Arene.
Thanks, Una. Over to you, Otto.
Hi, everyone. I'm Otto from Photon, co-founder, CEO. I will point out that I'm the only one here that wasn't accepted into an MD, PhD, got a PhD, or an MD. Humbled to be a part of this group. No letters behind the name yet, but the vision behind Photon is to build a prescription network that gives patients direct ownership of prescriptions. I would say in a lot of ways, our vision is aligned with the innovations that have come before us. So it's pretty cool to see Trevor talk. I'm a fan of the company you guys have built. I'm also an alumni of Walmart Pharmacy. So excited to be in between those two businesses here. But yeah.
Thanks, both of you. Eager to learn more about your target customers as well as your business models. Maybe take us through who Arene's customers are today and the medication management insights and recommendations, how they're driving value for those customers.
Sure. So Terry, you shared actually a very important statistic in the beginning of this. You said in 2016, there was a study published that medication mismanagement costs us more than 500 billion annually. So we spend as a nation that much on medications, so around 500 billion on medications in total. Then we spend that much, if not more, on the problems they cause. So this is indeed the largest area of waste in our healthcare system. 1 in every 6 healthcare dollars are basically wasted on solving the problems that medications can cause if used inappropriately, not to mention that it's the 3rd leading cause of death. That is why we are so focused on this mission of safe and effective medication therapy. And we know by doing so, we can help our customers, who are the payers and risk-bearing providers, both improve quality and reduce cost of care. So as Trevor so nicely put it, it's important as a company to be in the flow of funds. And so Arene is in the flow of funds because we're both helping customers improve important quality metrics like medication adherence measures, which helps them get their bonus revenue, so top line revenue, as well as reduce unnecessary utilization, complications caused by patients being on the wrong medications, which reduces cost of care. So both top line revenue, bottom line savings, and that's why our customers are those who bear that financial risk. And just to explain a little bit about how our platform works, the users of our platform are mostly the nurses, the pharmacists, the care managers who are part of the population health care teams at these plans or providers. And in addition, some of our plans also leverage like the pharmacy network to be users of our platform and the community pharmacies so that pharmacists can provide important medication management at the time that patients come and pick up their medications. And then our platform will generate patient-facing recommendations as well as prescriber-facing prescription drug change recommendations. And so it takes into account all available data and turns it into actionable recommendations around who needs a medication change and what should that exact drug and dose be. But like all of our companies, the ultimate customer is really the patient. And our goal is to keep focused on improving patient outcomes.
Really insightful and excited to learn more about some of the AI techniques that your team is using to power some of those insights. Maybe before we go there, and we'll circle back, Otto, would love to learn a little bit about the Photon product and maybe tell me what it would be like if I went to the doctor, they prescribed a medication, how do they use the Photon product? And then how does my experience as a patient kind of flow from there?
Yeah, totally. So without a doubt, being a prescription network is a very complex bit of kit. There's a lot of underlying connections and network complexity to build this product. But the way we think about that, to start with that complexity, but to imagine a world where prescriptions were a lot simpler for patients. And the simplest version of prescription is actually the way they worked in the 90s, when you had like a physical sheet of paper, you could walk to a pharmacy. That was obviously simple. It had a lot of drawbacks, namely handwriting and security. But a lot of the original product thinking around Photon really comes back to that, like restoring a patient agency. And what we found early in the process of building this, and I'll call out something that Trevor said, we don't really know what we're doing over here. Like we're experimenting with product and we're working from a lot of first principles. And that has netted the ability for us to play with new concepts that at scale are otherwise very hard to achieve. And then the quest for Photon really is just proving that this can work at scale from here on out. That's where we start to partner. That's where we start to double down on some of the bets that work. But in terms of interfacing with a clinician, to your question, today we sell a product that you can quickly integrate our prescribing workflows. We think of that as a mechanism to capture demand from the physician, to capture the prescription, capture the instructions clinically. But our core product, and really the place we're innovating, is in the patient experience. And we're innovating against the world where there is no interface for a prescription for the 95% of you prescribing today. No one sees it. It's like zeros and ones over your head experience.
Awesome. Super helpful. Definitely can visualize both of the products now. And maybe Otto, just to double back on the e-prescribing tool that you're providing today, tell us a little bit more, expand on how that's driving efficiencies for providers, even before kind of the patient experiences, the experience uplift, so to speak.
Totally. We built a provider-facing tool because it's pretty hard to get patients into your new prescription ecosystem without the tool. And it's pretty hard to get a big EMR partner to start working with the no-name day zero prescription network. So a lot of this is actually just a strategy to prove that this works better for patients by approaching it this way. So I wouldn't say that our physicians don't value our tool, but I think over time we're proving that the value of Photon is giving patients ownership. The value to the clinician is the fact that a patient can navigate on their own. The tool enables that, and I think a lot of our clinicians love our clinical works are pretty vanilla. And I say this with so much love to people on the Photon team are like spending all this time with clinicians to make sure these are like best in class clinical tools. But there's a lot of clinical tools out there. And we're saying our value is to work with the existing clinical tools, or you can use ours off the shelf. So I would think of it like we don't monetize the clinical tools. The clinical tools are a gateway to enable us. In the long run, I see Photon connecting with the largest EMRs. And maybe we have influence on their clinical tools by exposing new capabilities as the network enables those. But we're pretty
And maybe I'll circle back to that question from earlier, Una, around how you're using AI. We know that your team has been using AI models for years now to help generate and support your insights. Maybe take us through a little bit more how you've thought about building your models and using AI tools and what kind of outcomes it's yielding for you.
Yeah, sure. So we really believe in AI for this use case because of the following reason. If you think about there's new drugs being approved every day. There's new data out there on the drug, studies that say, who it's best for, changing clinical trial guidelines. And when you think about what it takes to get a drug regimen correct for a patient, it takes looking at their demographics, looking at their medical history and what other comorbidities they have, what are the conditions causing complications. It takes looking at their medication history, what has worked for them in the past, what haven't they tried yet. And it's a constantly dynamic, evolving process, as a patient journey is dynamic in nature, and their conditions or life situation changes. So what Irene does with AI is that we take in that available data, we look at baseline, we take in a plan's eligibility, pharmacy claims, medical claims data. And if there is other data available, we also pull that in. Like with our risk-bearing providers, we can also bring in that EHR data, and we form as comprehensive of a patient picture as possible. And then our AI comes in and looks at first, who is it that needs that medication change? Who is high risk yet impactable via medication change? And what should that medication change be, by putting all these multidimensional data elements together and turning it into that very actionable recommendation around what's that right drug and dose. So we believe in leveraging AI to make it easier for the clinicians and to free up their time to spend time on the actual patient counseling instead of figuring out what's going on. We also think that no human can get this right. I'm a clinician too. I used to do these medication reviews, and there's no way I could keep up with the medical knowledge that's required and come up with the right answer, not to mention try to piece together that all the data points and history of that patient.
Yeah, huge amount of multimodal complex data. And we know you referenced a data point from earlier in the presentation, the size of the prize, both in patient outcomes as well as avoidable spend. So really interesting. And Otto, maybe similar question to you. Your team's using automation techniques, I'm sure AI models in different ways. And my experience with the prescription process has been that it can be pretty glitchy. There's phone calls involved. There's maybe my chart messages involved. How are you automating some of that away?
Yeah, so our AI story is relatively early innings here. I think we're in this place where we're earning the right to really double down on that problem. I say this as a founder who's so tempted to pivot into the AI world and make that our core focus. The way I think about AI in terms of adding value is the same way the internet adds value. Like no one wanted to buy internet. A clinician doesn't care about AI, they care about the net outcome. Same thing is true for the patient. So our strategy in terms of employing new technology, not specific to AI, is just like, how do we create value with this? And there's two places we focus. One, there's features that we enable today that sort of feel like magic for a patient, where we're really blending the line between, let's say, customer support that feels better than anyone could ever provide for pharmacy. AI is enabling us to sort of lower the cost of high quality customer support for non-clinical stuff. Like getting a prescription filled, like you mentioned, is a mess. Lots of things are out of stock. Insurance doesn't cover things. Patients figure out what a prior auth is. There's text messages that usually go to a clinician. So we've proven that you give a patient a place to seek customer support related to fulfillment, that goes to Photon. And we can support patients at a much higher quality, lower cost. To be frank, this is why I'm somewhat of a bear on AI. Humans do this super well. Humans don't make mistakes. And actually, if you get really good at product and like operations oriented workflows, you can actually do a really good job with humans. And the way we've focused is give patients the feature to do the thing rather than just throw AI at the problem. A good example is number one reason a patient responds to Photon text is to change a pharmacy. So we just ship a feature to let a patient change a pharmacy. No AI required. So a lot of this is like first solve the problem and then stitch in AI where it goes. We've done some pretty cool other things with AI in terms of allowing us to capture supply side at a lower marginal cost. So yeah, net, the way I think about AI is it's magic under the hood, reserved for the benefit of maybe like Photon's margins, but it's never going to be the feature we're selling. And I think our capability of stitching in a real human being when it's right is critical for the quality aspect of what we're doing, especially because it's inherently high touch environment for a lot of these patients, right? They're getting a prescription for their kid. The margin for error is really low. So we take the quality aspect of this much more seriously than the sort of scalability part.
Great. Yeah, and maybe we'll get a little bit more tactical here with and what will likely be our last question. And so as you have navigated your way through startup days, you've both interestingly successfully found ways to partner with much larger companies in your startup days. So curious, when you pick your head up and reflect, what have been some wins or learnings that you've had in partnering with larger companies as a startup? And Otto, maybe we'll flip this one right back to you and then have Una wrap us up.
Yeah, as a first-time founder over here, the power of an enterprise champion is pretty amazing. There's been a couple of partnerships we've worked on recently, some of them with very large pharmacies or clinical partners. To get a clinical champion to take a bet on a seed stage company like Photon to do these things is crazy. So I understand the like sort of career risk associated with this for certain folks. But the inversion of that is to also provide value and do things. I won't say the specific name of the partner, but there was a partner call we were on where after we shipped the pilot, proved some value for a partner. Someone on the call was like, we've been trying to do this for 10 years and you guys did it in a month. Where the conversation that we had with this partner was at Vive, we shipped a piece of product, got some numbers for 2 weeks in production with patients and presented those numbers back to a partner. And so what I've learned about that is there's actually a lot of opportunity if you're a big Fortune 500 company to leverage little startups to go do the bullish on the future of small telehealth, digital health companies, focusing in the parts of these big healthcare organizations that don't have a line of startups trying to sell to them. And that's really what our strategy has been, not on purpose, but by accident, because I think we're building a space where, as Trevor said at the top of this call, not many people work. That works super well for us and is really the next phase of Photon. Go do that, but for 100 more enterprises.
And what have you learned with Irene?
So I completely agree with what Otto said. It's about providing value. And for us, it's, yes, providing value to the patient and keeping that goalpost on improving patient outcomes. That determines everything that we do, what products we build, what new features we're adding. Does it improve? Will it improve patient outcomes at the end of the day? What models we're building? That's our main goalpost. And then the second piece is providing value to customers. And in order to do that, it does take a lot of listening to the customers. And so, Irene, we offer 3 different solutions. Our sales team, when they're out there, it's consultative sales. It's understanding what the needs are of these customers and then guiding them to one of these 3 solutions that will help solve their pain points. So that, I think, just listening to what a customer is saying, understanding where they're feeling inefficiencies, pain, where they need to improve their cost structure, improve outcomes, that does go a long way and demonstrating outcomes at the end of the day. So what we do is that we agree when we enter into an engagement with a customer, we agree what the goals of the program are, what does success look like, and then we take it a step further and say, this is how we're going to measure that. And we transparently share that with like their actuarial, their health economic team. So everyone's on the same page. And at the end of the day, when we show that value, it's unequivocal that this is value that's been demonstrated by this program and attributed to this program. That's always a question. How do you know it's attributed? So that's where we use a lot of different statistical methods, match control type of studies that we agree upon in advance to essentially demonstrate that outcome very clearly.
Great. Awesome. Always feels like you're cutting it short with such great conversation. But thank you both, and excited to continue tracking your progress. And I will turn it over to my teammate, Michael Grilly.
Thank you.
Thank you so much, Tara and Otto and you. Hey, Dr. Wig, great to see you, my good friend. Thank you for joining us. We're going to compress probably 2 hours of conversation in 14 minutes. You've had an extraordinary career in healthcare, some of the most innovative companies. I'm going to let you take a minute or two just to more formally introduce yourself. But obviously, in your role as Chief Medical Officer at Walmart, you're playing a really important role in the pharmacy space.
Yeah, no, first of all, thanks for having me. And I think Trevor and Otto had mentioned this a little bit. I didn't start off wanting to be a clinician. Actually, I wanted to be a musician. My parents were angry with me as well, but my dad was a pediatrician growing up, and I just found a calling actually when I was a freshman in college, and so went to med school. Always had an interest to get into the corporate side of the world. Wanted to do things that were more wide-ranging and have an impact. But I trained as a nephrologist, a pretty challenging population, and from that just took an area of just trying to learn as much as I could. And so I've worked in the dialysis space and business development and innovation and operations. I've worked in the PBM space recently, and then Walmart. And so I've just tried to learn something along the way. I was very interested in pharmacy early on. And coming to Walmart, when I look back at my career, I probably wouldn't have been able to be even considered for a role like this, because we have 5,000 pharmacies, we have a specialty pharmacy, we have telehealth, we don't have our clinics anymore, but at that time we did. And so trying to have a larger, broader understanding of things and was also very helpful, but I've been really fortunate to be in the role.
Yeah, and Wig, I appreciate Walmart's a public company. Obviously, it's been widely reported, but just clarify what Walmart's healthcare strategy is and how pharmacy is playing a role in that.
Yeah, I think the way you want to look at a Walmart, and this is with CVS, everything is we're retail companies. And so this is really about doing what a customer needs across their entire life. And so one of the early data points with Walmart, the pharmacy has been around since the 1960s, was that there was a recognition that when a patient came in to use the pharmacy, they tended to actually use Walmart goods and services to an even greater degree. In fact, a diabetic patient in a Walmart typically spends about 6 times more annually in their market basket. So whether it's financial services, whether it's pharmacy, et cetera, healthcare was just sort of part of what we call our flywheel effect, where it drives a lot of different things. And so the pharmacy being the core tenant of that, we have optical as well, but it plays into retail, but it also plays into sort of being able to improve someone's life throughout their journey.
Innovation can go along 2 vectors. There's like product technology innovation and then business model innovation. Maybe paint a picture of what the Walmart pharmacy experience looks like 5 years from now. We've just heard from amazing entrepreneurs who are trying to help re-architect that experience. How do you think of that experience evolving over the next, call it 3 to 5 years?
Yeah, it's probably not going to be super exciting, Michael. And this comes back to the tenets of Walmart. 4,000 of the 5,000 pharmacies are in underserved areas. And there's a Walmart within 10 miles of 90% of the population. A core tenet of the business is being in the community. So when you think about innovation for what we're doing, it likely is going to be things where we're driving prices down based on scale. It's going to be getting medications to patients with their groceries. It might be making some assumptions on what a patient might do better with a specific medication, a specific food choice. A lot of the work that we've been doing has actually been more about figuring out our supply chain constraints. So central fill,
trying to make some medications more affordable. But I don't think you're going to see too much in the way of that. I think there's probably going to be more of a redoubling down on what the retail experience looks like.
And so Una alluded to some of the data challenges. Is there a model where with data, because you're capturing such extraordinary amount of data on any one of your consumers, that'll change how you serve those customers? What's the role of data over the next couple of years?
Yeah, this is also a challenging question because there is a very significant sensitivity to data privacy and protection. And so we've had a lot of discussions on what retail data looks like, the pharmacy and medical claims data, how does that inform the experience? And I'll just give you an example. Within the medical office, we started a research institute, and this was not to become an academic center or be a clinical research organization. It was more about that the pharmaceutical industry was really looking to learn more about the real world experience of what these drugs look like in populations that they typically don't see. So when we think about our data, are there ways that we can anonymize it, begin to think about some insights that we can feed back to pharma in a safe fashion? That might be one thing. The second piece is also understanding who are the patients that we should be messaging to. So we know that, for example, somebody who votes in the midterm elections, they tend to have about a 3 times greater lift of opting into any clinical program or service. They're much more engaged patients. So I think those are the things that we can look at. And then the third example would be, and this is not something that we've launched, but we were able to begin to pre-predict somebody based on their food purchasing behavior, whether they might progress to diabetes or not. So there's a lot of different things that are out there. I think the pause and hesitation is how do you protect that and how do you have the right guardrails in place?
Yeah, but some of those solutions exist. We have portfolio companies like Health Verity that can do that. Is it on your roadmap, to the extent you can comment, where you'll begin to multiplex these data sets and then activate, incentivize, engage your populations differently?
It's definitely on the roadmap, I would say, and this was a question about, I think that was asked earlier about how do you engage with large companies. I think with Walmart, a lot of the work with regards to that are done in-house. And so I think, at least particularly with the Walmart experience, there is less of an interest in outsourcing those things, but it is definitely on the roadmap in terms of a common data model and thinking about how we look at things across the journey of the customer.
Yeah. And I hate to hopscotch around, but I'm trying to get a lot of content in a very short period of time. Formularies are under a lot of pressure, obviously, drug pricing, big topic. I'm sure we'll talk a lot about it Thursday night in the debates. How are you positioning against some of those changes in formularies? Like, how are you managing through that transition?
Yeah, so I think if you have particular clients like employers or health plans, et cetera, that might be using our pharmacy and network, those formularies are there. And then obviously you have the GoodRxs of the world and other ways to get around that. The ways that we've tried to be more impactful is particularly in patients who don't have insurance. We came out very early with a $4 generic program where a list of medications can be bought for $4 for 90 days. Amazon is doing very similar things. There's probably going to be a world in which you make all generics free and you start to think about the larger value that you might get from a patient. They get their generics from you and maybe they're buying weigh scales and other digital tools. That's one part. The second part is to start thinking about even specialty medications differently. So could there be a world where Botox, for example, there's a cash-based allowance for Botox that typically is not being seen in the underserved communities, and we have the scale to drive those. Worked very closely with pharma, particularly on drug launches. So if somebody has multiple sclerosis, can they come in and do their injection in a Walmart? And in that instance, if we're able to drive adherence for a PBM or a pharmaceutical manufacturer, is there particular value that we can unlock? So it all comes back to using our scale, but then also always thinking about the retail footprint and patient traffic.
And those are examples of things you've done successfully. You're seeing real adoption.
So some of the examples are more kind of things we're looking at, but insulin would be one where we are probably one of the largest, if not largest, cash-based insulin sellers in the country. We have a partnership with Novo where we have a white labeled insulin that we sell, and that's at a pretty discounted price.
Yeah. Obviously, I'm going to ask about GLP-1s. Any perspective on that you'd offer as it relates to the pharmacy industry?
Yeah, with what I can talk about, I think it was very unexpected. I expect obviously this is going to continue and probably increase. There was some recent data now just about kidney protective effects of GLP. I think the challenge that everyone is facing is the appropriate use of GLPs and whether this is a chronic therapy or not, and what are the wraparound services that you could think about. Some things that have been contemplated is, do you have a center of excellence for obesity where GLP utilization is considered, but then you also consider all the wraparound. So maybe there is digital weigh scales, maybe there's healthy food choices that are discounted. What are the ways that we can try to impact care, and maybe not in a pharmaceutical way, but also in ways that we do best?
Yep, yep. The workflow and the staffing shortages that is endemic to the industry right now. How are you thinking about the role of automation behind the counter? Where do you see that evolving?
Yeah, so we've been trying to do some things with pharmacy technicians, in particular with automating some of the administrative tasks. That's actually been quite successful so far. So it improves time for the technician and frankly for the pharmacist to operate their scope of license and central fill. But a lot of the way Walmart's pharmacies were initially constructed were based on older systems. And once you're embedded in these older systems, beginning to try to work your way out of that is a little bit of a lift. But that was one example in terms of pharmacy technicians where we've been using AI to take some of those manual tasks and automate those.
Yeah, we just have a few more minutes. I want to shift towards, we just heard from 3 exceptional entrepreneurs. Where do you see the white space? If you were to start a new company to re-architect the pharmacy industry, where are the white spaces, do you think? Or what would be it? And then conversely, what would you avoid?
Yeah, there's a whole lot of things to it. So I can just tell you something that's always been interesting to me, and I think some of the folks have commented on it, is when you think about the use of medications, it's very interesting that you have a very restrictive approach to what medication should you be on. Why does it need to be 20 milligrams of Lipitor? Why isn't it 10.5 milligrams? Why is it that in 2 or 3 months, your weight may change, your absorption may change, your diet may change? A concept of a living, breathing formulary is very intriguing. That obviously would blow up the economic model of most PBMs, if not all PBMs in the country. But I like the idea of drug efficacy and really looking at what the true outcome of a drug is. Particularly in specialty, there's a lot of diagnostic companies that are really interesting to see about efficacy and adherence. Those things are really interesting to me.
Yeah. Anything to avoid?
I think one of the things maybe to avoid is and this is particularly if somebody was to come into a Walmart and pitch an idea or anything like that, I think it's really important to understand a little bit about the company and their makeup. So for example, for us, unless it's something that can be scaled, GoodRx would be a great example. Those are the things that we would look at. So really being able to think about who you're coming after, I think is probably important. I probably wouldn't say anything to avoid because I think it's also great because these folks that just got on the phone and did this, they clearly took a risk and it's been very impactful.
Yeah. Wig, I think we're at time. I just want to thank you for participating, but also thank you for everything you're doing. Una mentioned finding clinical champions. You've certainly been that to a lot of great entrepreneurs out there. So thank you for everything you've done for the industry.
Thanks for having me.
And with that, I'm going to turn it over to Tara to wrap us up. Tara?
Great. Thanks, Michael and Dr. Wig, for the insights. And as our panelists are dropping, we'll just conclude this session by thanking our guests for their time and their perspectives. We covered a lot of ground, always more to talk about, far more than an hour. So please reach out to us at Flair if you'd like to continue the conversation. And again, we look forward to seeing you at our next quarterly expert roundtable. Thanks again, everyone. See you soon.